Freda, thank you very much for doing this. I mean, requires a little bit of explanation. I was supposed to be doing this with Nancy Snyderman, who happens to be a friend of mine, and her father is dying, and Dr. Nancy Snyderman on NBC. And Freda Lewis-Hall, I had never met, and I had heard about, the chief medical officer, EVP and chief medical officer at Pfizer, biggest pharmaceutical company in the world. Pretty good substitution here.
I hope so.
Nancy was impressed. And so, as you probably have read in the news this week, Pfizer has made a bid to acquire AstraZeneca, $100 billion deal potentially, and this would make the biggest drug company even bigger, like a $300 billion revenue company, which is incredible. And Freda really can't talk about that, but you know, kind of makes her even more important potentially than she already is. So
well, it certainly makes it exciting. I think that the role that I have as the chief medical officer is probably one of the most exciting roles possible for me as a, as a physician.
So we're going to talk about, one of my first questions is going to be, what is a chief medical officer? But while we're talking, think about your questions and comments, because this topic about living a healthy life is one that absolutely requires audience engagement, and it can't just be us talking up here. So before we get into what you do at Pfizer, Freda, let's just give this group a little bit of your background now. Mm-hmm. I understand that you actually decided at age 6 that you wanted to be a doctor, and how did you come to that decision?
I did. There were a lot of things that happened when I was young. My father was one of 16 children, and he and my mother had moved from their hometown of Richmond, Virginia to Washington, D.C. When I was born, my father's brother, 1 year younger, who was a paraplegic at the hands of polio, came to live with us to take care of me so that my mother could go back to work, which is a real irony, right? That he who needed care actually came to care for me. Our family physician and the many people who contributed to his care were amazing, absolutely amazing. And I just wanted to do that. Dr. William Settles, who was our family physician, served our close-knit community in such an incredible and caring and thorough way. I thought if there was anything to do, I wanted to be able to do that. So that's how I came to it. And you might imagine that in 1963, to tell my parents that I wanted to be a doctor when I grew up, an African-American girl in essentially still somewhat a segregated South, I was told that that would work. My parents believed I could fly. So they said anything it took, everything it took, they were willing to do that. And so the community kind of my family and friends supported me, and
so
here I am.
You actually got your degree in psychiatry.
I did.
And why did you choose psychiatry?
So interestingly, when I went to medical school, I was on pediatrics. I was particularly interested in the care of children and thinking that that was the right healthy start. I did a year in critical care pediatrics as an intern, and then realized that of all of the shortfalls that I saw, mental health was an enormous one, and one that wasn't quite catching up the way that many other areas of healthcare were. That was number one. And then number two, the age of biology of the brain was being ushered in the 1980s when I started my training. And so it became fascinating to me to begin to have the science that would be the foundation of understanding the brain. Mm-hmm. And that understanding would confer into psychiatry, and we'd be able to make some headway. So I really felt that that was a nice cutting edge place to be, with a tremendous need in the healthcare community.
So tell us what your role as Chief Medical Officer at Pfizer involves.
So first of all, for anyone who knows Chief Medical Officers, you know that if you've met one, you've met one. These are roles that have grown up quite recently, actually, and depending on where you are in the industry and what you're doing and what company you're in, you may have a range of responsibilities. So I like to add my responsibility up by saying I'm responsible for the safe, the effective, and appropriate use of our medicines from the first time any one of our medicines touches someone in a clinical trial to the last time anyone touches one of our medicines anywhere in the world. And so in order to do that, I work to support the integrity of the data in those clinical trials and the safety of patients in those clinical trials. Once a product makes it to the market, we're responsible for supplying the information to healthcare providers and to patients so that they can safely and effectively use those medicines. So the organizations that are a part of the hundreds, or that are made up by the hundreds of people that are in the medical division, have to do with quality assurance, with medical information, and we field 1 million inquiries or more a year from healthcare providers and patients around the world. Everything from, is there gluten in this capsule, or you know, I left my medicine in the glove compartment at my mom's house and, you know, it was 100 degrees, can I still take it? Mm-hmm. To very sophisticated and complex questions that are being asked by clinical investigators who have questions about the medicine, and kind of everything in between. So it is, you know, kind of the support and oversight of safety and quality and medical information as the service, but also our publications and our medical education platforms. So there's a lot in between that supports the safety of our patients.
I want to go back to some sort of big picture pharmaceutical industry issues, but because this session is about health and leading a healthy life, I want to zero in right now. I want to jump ahead to what you can tell us about how we can lead healthier lives. So the people in this space, by virtue of the fact that you came to this conference, you are no doubt successful, type A, stressed out, right now trying to do 2 or 3 jobs at once as you're here and trying to keep a handle on things back at your office. For this kind of audience, most of whom are, how many are baby boomers, officially baby boomers? Okay, we have actually some younger people and older people here. What do we need to know what are the myths and misunderstandings about what we need to do to live healthy lives?
Okay, so I hope you all are here for the long haul, because this could take a while.
Go for it. Go for it.
So actually, let me correct one myth, and that is that access to health care doesn't necessarily translate into health. And there's a lot of responsibility that falls on us as individuals that we have to be prepared to take. And you know, kind of financial acumen and career success and other things don't necessarily translate into having all of the tools that you need to live a healthier lifestyle. And many people believe that that's the case. So there are a few things, though, that I think everyone needs to do, this audience and anyone you know, outside. First of all, and this is going to sound very trite, is to know yourself. I would bet that most people in this room do not have a well-articulated health history located in an easy-to-find, accessible place, that if you fell on the floor right now and we took you to an emergency room, we would be able to access with the important information about you to aid in your medical care. And I think that is really job one. So really understanding you from a medical perspective, collecting your laboratory tests and information, your medical history. Did you have surgery at some point? Are you up to date on your vaccinations? And if so, where's the information about that? Your family history. You know, people often have vague notions of you know, what happened to even their first-degree relatives. That information should, you know, should be a part of a well-articulated, easily accessed health history that you have.
Okay, I'm going to interrupt you for a second. Where do you put this? How do you do this, and where do you put this?
Well, it's interesting. I think, you know, many people think it has to be electronic. But when I was actively practicing, you know, pre this, I had patients that had written their health histories, if you would. So whatever works for you, I think would be the answer. Some people keep journals. Some people just keep a file folder, kind of with a running record in the front. Many people, with the advent of apps and computer-based programs to have personal health records, do so there, and some even keep it in the cloud so that it can be accessed by their physicians. Some people have healthcare teams that have electronic medical records that allow them access. So,
how many of you have this? Okay, good. So this little
ding,
group
ding,
over
ding,
here wins the
okay,
prize.
so 2 wins
okay, good.
over here.
Good.
But it's,
okay.
But I think you made the point by asking, you know, who really has that? And the health histories are hard to get. You know, my father is 95 years old and in amazing health. But if I asked him, you know, what did your grandmother die of? He cannot tell me that. You know, she died of old age, or somebody's heart gave out, or, you know, so medical histories are hard to come by often. If you can get those, you know, that information in a more specific way, very helpful. So the number one is know your health history, your personal one and your family one.
Okay.
The second thing is to assemble a team of kind of health professionals that are going to help you. And many people don't even have a primary care physician. They have a, you know, kind of a range of physicians, nutritionists, physical therapists, but a lot of these are what I call episodic relationships with the healthcare system. So I see you when I'm sick, or I see you at the point of an annual exam, but I don't really have a health plan with you. And I don't have a broader network that helps me address some of the issues that I have. So the second thing is really putting a health team together. And you can start by putting the one that you think you need. The next step is putting a health plan together. When I mentioned, and with that is a now assessment. Most people know how tall they are and how much they weigh. Many people don't know a lot of other information about themselves. I've asked people, you know, how many of you routinely monitor your skin, looking completely at yourself front and back to look at any moles or skin lesions that might arise? And when I ask that, so there, you know, 1 or 2, and that's what happens most of the time. You know, we look at ourselves every day, but we don't look at ourselves from a health perspective every day. And there are many things about us as a, you know, right now, how are you doing? Is my hair thinning? Am I losing my eyebrows at the outer edge? Am I noticing any changes in my skin? Am I noticing any changes in my body shape? Am I noticing, you know, this can go on and on.
What does that mean if your hair is thinning or your eyebrows are disappearing at the outer edge? What does that indicate?
Many people with hypothyroidism develop those very subtle signs. And there's also connectedness of the outside to the inside. So very, you know, thinning and brittle hair, for example, can be an indication of changes in your nutritional status that you could check into. Deep furrowed lines in women who are around menopause, it's been demonstrated in some research, can be an indication of bone loss, right, an underlying bone loss. So really looking at yourself and noticing even subtle changes relative to a health lens can be important. Measurements, I did, this is actually one of my favorites. You know, the statistics around being overweight and obese are quite striking. But if you ask a group of people, are you overweight or obese, it's very hard to get hands raised. And as we talk to people, you realize that they don't really know what the lines are. Many people don't know their BMIs. They don't know that even within bound normal BMI with a waist circumference of over 35 if you're a woman and over 40 if you're a man are also important health signs. So these are all very subtle but very important things for you to know about yourself and then to begin to monitor. And then develop a plan to address those issues. So if you realize that there is something that is a subtle change, or if there are health habits that you have captured and understand, you're not sleeping well, your nutritional status is off, you're not exercising, whatever it is that you can actually change, then sit with your health team to make a very specific plan and then begin to tackle it in a focused and prioritized way.
Are we the most stressed out generation, population that there's ever been?
You know, it's really interesting. I mentioned my dad, who's 95, and he gives me a lot of checks on, like, oh, these things are very different. And he goes, you haven't seen anything. You should have been around 1930. And so, I mean, I think statistics would suggest that we are certainly a generation that is succumbing to many of the stressors that affect us, but and a lot of that has to do with the way that we interpret, incorporate, and respond to stress. And a lot of our stress is, this is probably not the right word, but is self-allowed or self-inflicted. Huh. So the information overload, the schedules that we keep, the disrespect that we have for sleep. I know I do. And, I think we allow ourselves to make decisions that put us in many more stressful situations than perhaps we must. And, so there are a lot of things that are recommended. And of course, there are some stressors that we are absolutely not in control of. But many of us haven't done a stress assessment. What are the things that really make a difference? And how can I respond to those in a responsible way? Many of us are in the should, must, have to camps, and spread ourselves far too thin. So these are all things that research has told us are in the long run quite unhealthy.
Yeah, what do you mean this disrespect we have for sleep? At least I do, you said.
Yeah.
You really have I don't have a disrespect for sleep. I love sleep.
Oh, I love it, but I don't get much of it. And I mean, we travel time zones.
Yeah.
We schedule ourselves late into the night and early into the morning.
And that is probably one of the simplest, best things we can all do, get an extra hour. How much sleep do you think you really need to function?
Oh, well, I need,
well,
yeah. Well, I think, again, back to the self-assessment, a lot of people don't really even know what they need. Right, they don't know what they need. Some people will say, you know what, I only need 4 hours a night. Really?
Yeah.
So how you doing with that?
I don't believe that. 7 hours, so you kind of know. And also, the quality of sleep is very important. It's not just the duration. Yeah. And many of us have, the effective sleep, about 50% of people report significant sleep disturbances. And some of it, again, is self-controlled. So how many people here sleep with the television on in the background? Or iPads, iPhones, computers, and other electronic equipment somewhere around you, right? Lights on, noise in the background. I've really tried to stop having that electronic stimulation like a half an hour before I go to bed, because I've heard, and it's,
yes,
you probably understand how it affects the brain, but that kind of like stays with you when you turn out the light and try to go to sleep, right?
Well, it does, and that ambient light in the background, that little blue light that shines on your, on your pad, or the little buzz sounds, all of those things kind of interfere and interrupt, and it's important for you to kind of understand what it is in your sleep pattern. How much do you need? What is the quality that you're getting? Are you well rested when you wake up in the morning, or do you feel as tired when you get up after 6 hours as you did before you went to bed? Accumulated sleep loss, of course, is an important, it has an important impact. And again, there are a lot of things that you individually can do as you understand what affects you to change that around.
Okay, who has questions or comments? Yes.
Hi.
Hi.
I'm Seth Ginsberg with the Global Healthy Living Foundation, and wonderful discussion, great dialogue. And I want to talk about, or ask you a question to shed some more light on this notion of our health information and the data and how we're doing. You made a really well-articulated point about not knowing what your grandparents have, that legacy information is lost. And I'm interested in two points. One is how to do this in a system which lacks continuity of care, total continuity of care. Nobody has the same doctor year to year. No one has the same insurance company year to year. Medicare administrative carriers certainly aren't interested in banking our information for us, those kinds of things. How are we going to innovate this to break into a closed network system that's broken? And the second question is biobanking. Wouldn't it be nice to ask our relatives to all send a vial of blood somewhere? And isn't that actually far better than any information we could scribble on a notepad or keep in the cloud or on a thumb drive?
So great question and comments. There's really a revolution available to us today in two ways. So one you talked about was the data availability, and the other is kind of the diagnostics capability. And if you think about it, what happened between 1947 and 1953 was shape-shifting, right? The transistor for us to be able to do the data transfers and the data captures that we currently have available to us, and in 1953, DNA. So yes and yes, it would be wonderful if we were able to biobank, not just for our own personal histories, but to begin to use data and information that comes from tissue samples. And it may not just be blood, right? It may be kind of a range of data and information that comes from our bodies. People who have been ill and have tumors biopsied, for example, and other information that is very helpful, along with genetic information that helps. And we now have not just genomics, we have metabolomics, so metabolic pathways that can be captured through blood samples and tissue samples and other. We have proteomics, which is kind of understanding our protein behavior in our body, which can be very telling and has been groundbreaking in discovering new foundations of illnesses and things that we can do about it. So yes, if there was a way for us to do a broader capture, you're thinking like the next level and beyond, right? Yes. And the other is a very interesting question, and one that I think, and that is, how do we in this fractured system get the kind of holistic picture of ourselves and care that I just talked about? You notice that I say you do it, right? You do it, you capture it, you have it. Because our system is in change and flux day to day with the healthcare team that you're interacting with, and then it's in change, you know, in the broader way. So I do think that those things are wonderful and are being worked on in some ways systematically, and in some ways in pockets of expertise. I think we will get there. But what I say for myself is, you know, in 1977, my father came home from work and found my mother unconscious on the floor. She died a week later from a stroke. At the point that I got to the emergency room and my father got there in 1977, although we knew my mother incredibly well, neither one of us, and I was in medical school, neither one of us could give the health history that, you know, could potentially have made a difference in her outcome. We hadn't, you know, we didn't know whether or not the blood pressure that had been diagnosed the year before was actually down into the normal range. We didn't know any of those things. And that's why I said the onus is on you as an individual, I think, to a certain degree, especially us in this room that could be on the cutting edge and begin to understand how to get these things done. So, again, I think we have the personal responsibility for those of us who are chief medical officers of our families to collect that information and have it for our families. And then for those of us that are able to advocate for these changes in the system that will allow us to kind of have a future that responds to those comments that you made about the fractionated system and kind of a lack of holistic data and information help us.
It just seems that there should be some company, whether it's a big company like Pfizer or some entrepreneur, who would come up with a way to enable us to collect this information more easily. And I mean, I'm already thinking about like going home next week and trying to do this, and I'm thinking about calling all of my doctors and specialists, and I have arthritis in my hips, and every month I go to someone new who I think is going to be the magician to solve my problem. And I'd be calling a lot of people, and they still would not, there would still be nobody in charge except for myself. What's the better solution? Is there a solution to this, or is it really in our hands?
I think ultimately we will be delivered a solution, but I think for now the solution is really us. My daughter, when she was 5, my husband is an order giver, and she said, why are you always telling me what to do? And he said, because I'm in charge, that's why. And she said, well, you in charge of you, I'm in charge of myself. And I think from a health perspective, and the rest of the history is really rough too. But the idea is she is in charge of herself, and I'm in charge of myself, and you're in charge of yourself. And I think from a healthcare perspective, it's an area that we wish we could give. This is so complex. But you do it for your car, you do it for your computer.
Right.
You do it for the other very complex machines that operate at your home, and sometimes you have to do it for you. I've been told that if you collect the history, once you get the hard part done and you've gotten caught up to where you are, it's a little bit easier. And many people have systems that work for them, just as they do for keeping their family pictures in something, or keeping their financial information in one place. So all of this is very complex, yes. And I think it's on us for now.
So do you do it? Do you have it?
My husband does it.
Really? Wow, good for him.
My husband has had a series of illnesses, and we realized, and we move a lot. So his medical care transmits from one place to the other. And so he's gotten really good at keeping, putting a system together that makes sure that we can pull out histories and remember what happened.
That's great.
And it's interesting because he has, that I'm the physician and he has an eye for this, but if someone asked the question, did you, have you had one of these, when you're filling out your forms in the new form that you fill when the new doctor you see.
Right. The endless
I'm
form.
checking things, and he's like, no, not really. Do you remember in 1989 this happened? I was like, no,
Wow.
I don't remember what happened yesterday, let alone what in 1989, which is the other reason, by the way, that you should keep this information.
Yeah.
So I think, again, in the same way that that in recycling and drinking water and some of the things that 10 years ago, who would have imagined is as much of a habit in our culture as it is, I think owning your health care will be, or at least parts of it are going to be an important part. And and I'm sorry I didn't get your name that asked the question earlier, to that point, I think that'll be a part of what pushes our system to be responsive to that need. So we'll create a demand for these platforms, and I think that'll be an important pivot for us.
Who else has a question or comment? Anyone? Yes.
You talked about the future past profiling. How about the future profiling? Do you see companies like Pfizer coming up with devices where we can store stuff like real time and upload it to the patient, to our doctors also, in kind of content management? Do you see companies like yours taking such initiatives?
So thank you for that question. It's So the core of our business is our innovative core, is the work that we do to advance new treatments that improve patient outcomes. As a part of that, we're learning that we have other jobs to ease that. So we're working very hard to improve our research and development outcome, and we are as an industry, we certainly are as a company, but we're also recognizing that at the other end of this spectrum of healthcare, that having easy to use tools will make our interface with patients and consumers more profound. For me as a chief medical officer, it also means that we may have an opportunity to do two things. We may be able to create a dialogue with people that helps us collect data that becomes important in discovering new drugs and devices and diagnostics that will make their lives better because it'll be informative and patient focused. There's a real movement towards that. So yes, we're in the game, but I'm not sure that we'll be able, because it's out of our core capability. My best guess is that it'll be more partnerships with companies that have this kind of expertise that'll allow us to move some of these things forward. I made the point about interfacing with consumers and providing information and support. One of the things that has been very interesting for us as a pharma company is that we really are separate from the people that we serve, from patients that we serve. And about 2 years ago, we looked around and said, you know, how can we actually change that paradigm? How can we advance the conversation with patients to help ensure the safe, effective, and appropriate use of our medicines, but also contribute through our knowledge in various therapeutic areas? You know, how can we help with that? And so we started a program with CBS television distribution. And it started with just a few segments on the doctor's television show. And we provided general information, not about our products, general health information that was you know, pulled together by our experts and other experts, and that shared. We established a website called gethealthystayhealthy.com, which was a waypoint for people to get to what we think is another absolutely critical part of your healthcare, which is having some trusted sources of information, right, preset. So we set up this website, and that has now grown to probably about 20 or more shows in a season. I do integration segments on behalf of Pfizer and working with CBS television distribution on the doctors, on Dr. Phil, have done several on Rachel Ray as well. And so it's been quite dramatic, and the research that we've done as a result of doing that information is that we've really hit a home run, in that we're doing it where people seek and already see health information, and that is online and on television. And the information that we provide is generally actionable, which is, you know, tonight pick up the phone and call so-and-so, go on and get information, do this or don't do that, not
and what have you
advice.
gotten the best response? What has been the most kind of impactful segment that you've done that got the biggest response?
I think recently our program on fibromyalgia was really strikingly responded to. It is a very active community of patients with fibromyalgia and people that care for them. And so they became very active and appreciative of the information, connected into websites, started talking to each other about the illness. For me, one of the most impactful was very early in this effort. We did a show on stroke. We got information that even when people knew the signs of a stroke, they failed to dial 911. They would say, wow, yeah, no, I have a little weakness on this side of my face, but I'm kind of thinking if I took a nap, it'd be better when I got up. And so we pulled together data and information. It was shocking to me, but I heard the story over and over and over again. Soon after that, a woman wrote in and said, I think you saved my husband's life, because he sure enough said, we gave the fast, you know, your face, your arm weakness, your smile if it's lopsided, and then time is of the essence. And she said, when you told us that, he had all the symptoms, and he was like, no, I think I just need a little bit to eat and lay down. She was like, no, they said go to the hospital, so we took him. And sure enough, he was having a stroke. So again, I think this is the, you know, very basic but critical information to be provided, and it's been, so that's two ends of the spectrum, right?
Yeah.
A powerful consumer patient community that responded to us providing information and wanted to help continue to address this important illness, and at the other end was this amazing response. I get chills every time I think about it, to just say something simple that, you know, rang in someone's ears and could potentially have saved someone's life. So all of that is very satisfying.
What is the most vexing problem in healthcare? Disease, problem, issue? So
I'd have to say Alzheimer's right now for me. I think that it is it's the wild card in the aging scenario. I think that we will continue to make headway, and we have tools to do so, to stem the tide on many chronic illnesses. Many of them are lifestyle driven. If we can crack the code on how to get people to take the power of what they know to do to the power of what they do, we'll be able to pull down the effect of many chronic illnesses, and we'll enjoy not just longer lives, which we do every day, but we'll be able to enjoy healthier lives. I think Alzheimer's is the wild card, though.
What do you mean? Because there's been so much. There have been, you know, front page New York Times stories about advances in Alzheimer's research in the last, year, I'd say, and it seems like there's some progress being made. And you call it the wild card because? Well,
it's the wild card because the rates of not the rates themselves of Alzheimer's, but the number of affected people are becoming higher and higher. So the personal suffering is tremendous. The impact on caregiving is overwhelming. So not only does it affect the individual, it affects the family in a very profound physical, emotional, and financial way. And it affects our economy. Right. Unstemmed, by 2050, this will cost $1 trillion. And that's in the US alone. Globally, this is a very significant issue. So unless we're able to convert these scientific discoveries into meaningful clinical interventions, Alzheimer's has the capacity to bring us to our knees.
And the progress of Alzheimer's as a disease that could bring us to our knees, the increase in cases versus the apparent progress that's being made in the research, does that make you feel more positive or less positive than you felt about tackling this disease 5 years ago?
I'm a positive person.
So
yeah, I'm the one that, I say, if there is the opportunity for a man to jump out of a Mylar balloon 24 miles above the earth and land on his feet, we ought to be able to get Alzheimer's under control. I'm just saying.
Right.
So, I believe in, that anything is possible. And there have been dramatic findings. I think there are a couple of things that are missing. Well, one is intent. And we've demonstrated an intent before with polio. I have a picture which is one of my favorites. It's me and some of my cousins in front of my uncle when he had a full spinal fusion so he could keep up on crutches instead of to be a wheelchair bound, and he was in a rehabilitation hospital for about a year. So every Sunday we would take the 35-mile drive and visit him and hopefully lift his spirits. But there's a picture of all of us in front of him. In 1925 he was struck by polio. By the 1960s, when we were taking this picture, my cousins and I didn't know anything about polio except through him. So the power of intent, like we are tackling polio and we are not playing with it, brings these kind of dramatic results. AIDS, we demonstrated that we could do it again. Alzheimer's, I think we need some intent. And we hear it, right? It's being talked about more. There are coalitions that are being built. There are plans that are being drawn up, and implementation against it. So I think we just need to continue on that line. The second thing that we need, I think, is meta collaboration, which is the other thing that drove the difference, I think, in polio and in HIV, which is, you can't do it at your company by yourself, and I can't do it at my company, and you can't do it over at your university, hiding in the lab by yourself, doing ta-da, right? We don't have time for all of that. So what we really need is all hands on deck in a well-coordinated set of activities to answer the unanswered questions, to bring down the barriers, and to be able to move this along more quickly than the traditional pathway.
And what did you call that? Medical aberration?
No, that's what I feel it is sometimes, but it's
medical
meta, like super big meta collaboration.
Oh, I thought you said medical
aberration. Yes, we got some of those too.
Collaboration. Okay, got it.
Yeah.
Okay.
So
and is that happening?
I think it is.
Where is that happening?
If you asked me, well, I think it's these collaborations between universities and companies, advocacy groups, and patient governments. So it really has become an all hands on deck.
Is Pfizer deeply involved in that?
We are active in this space as well. So I think many companies are working on this and will continue to work. We're amping up our activities, and I could name a list of collaborations on imaging and biomarkers, and so the work is happening, and it's happening, holding hands. And I think that with this intent and the collaboration, I'm very hopeful that we're going to be able to do something meaningful in the not distant future.
That's great. So I have in the next issue of Fortune, which comes out on Thursday, and this will be online on Thursday, I have an interview, a Q&A with Melinda Gates and Susan Desmond-Hellmann, who is the new CEO of the Gates Foundation. She's actually starting in the job on Thursday, and coincidentally we have an issue of the magazine coming out on Thursday. So I went to Seattle and I interviewed Melinda and Sue a few weeks ago, and do you know Sue? She was at Genentech.
Yes.
She was the president of Genentech, and then the last several years she's been the chancellor at UCSF. And so if you were Sue, and you were going in to run the Gates Foundation, what would you spend $1 billion on? I mean, they have 40 billion, but I'll just ask about $1 billion. An extra billion.
Yeah. I'm excited about the strategy that they have now. And the work that they're doing is very strategic, very well organized, and I'm really excited about some of the people that I know there in research and development who have come out of the industry, in fact, and the way that it's shaping up. So I'm not sure that I would change their strategy on neglected tropical diseases and infrastructure build, because I think that it's it'll be an important meat to some of the other work that's being done by other organizations in tackling health diseases. So they're still helping to build an infrastructure for these long-standing, vexing challenges like malaria, or the things that are on the comeback that we've neglected, multi-drug resistant TB. They have a spectrum that I think is going to be fantastic. There are other organizations that are focused on chronic illnesses that are a part of what's happening around the world. Frightening increases in obesity, diabetes, and cardiovascular disease. Rampant smoking still. Changes in diet that need to occur unless these growing populations around the world create a drag on the overall health of the world. So, you know, I think there are other organizations that are doing that. And then still others that are focused on kind of bringing the technology wins that are going to be required. I'll just give one example. I work with an organization called PCORI, the Patient-Centered Outcomes Research Institute, which was established as a part of the Affordable Care Act several years ago. And we've been working on this outcomes research. One of our projects, we have many projects, but one of the projects is an infrastructure build, which I'm going to consider at the top of this kind of necessity pyramid, which is a data collaboration between 29 organizations that begins to build a data warehouse from which we can do methodologically sound outcomes research. So how do we take population data, big data if you would, that is organized in a fashion that we can get at it in a meaningful way, systems that talk to each other so that we can understand it, married to methodologists who are scientists in the area figuring out what to do with this data to answer important health questions. So we're beginning to ask questions that are important, vexing health questions for our nation that we think will provide answers and a way to get answers for the future for the globe. So that was a long answer to, I should have said one thing probably.
No,
but,
that's okay.
But I think this is another piece of the meta collaboration. They have an important platform. It's kind of taking this step back to say, you know, here are the 20 things that are, you know, that are pulling at us. Okay, you do this one, you got it? Okay, great. You all work together and take care of that. Okay, what about this one? Okay, you all over here, you got it? Okay, that's great. And I think that that's really beginning to happen in philanthropy, with governments, in industry, where we're creating these public-private partnerships that are tackling these. And of course, the Gates Foundation is one of the most important and impactful.
Good. Yes. Uh-huh.
Going back to Alzheimer's for a second, how critical is it to get NIH and other governmental support in terms of research dollars? That seems to be a big challenge.
So NIH is in the game in a very big way. The new brain mapping platform, we think again, and I mentioned earlier, one of the challenges in tackling Alzheimer's is, you know, really understanding the brain. It's one of the few organs in your body that you can't, you know, that is not intuitive how it works. So it's not intuitive how it doesn't work when it doesn't work. And so this mapping process, which I think is tremendous, will be, I think, equal to the Genome Project in giving us important answers to advanced science. Funding for research and development in this area is really critical. And it's challenging, you know, everywhere in private industry. We've had several sessions over the last couple of days. You know, looking for cures is high-risk business. And helping to support the notion that NIH as a pivotal scientific organization in this area is important. So, you know, please support that. And coordinating the work and the investments of others around the world into this area is also very important. Yes, ma'am. I think there's someone
over
who's
here
in the lights.
Yeah.
Sorry.
Hi.
I had a comment and a question. In terms of your idea of the galvanizing event that could cause movement around Alzheimer's, the White House Conference on Aging, which is scheduled to happen next year, could be a time for the boomers to get on board and support that. And the second thing is, I saw at the M Health conference, there were some companies that were both developing medicines to help with Alzheimer's as well as technologies. And we see a lot of startups that are looking at new technologies. There's one coming over today in music. So I think there could be some coalitions where the startup tech companies could partner with the pharmaceuticals. And I don't think it's happening to the extent it could.
Let me do your second one first, which is absolutely right. There are many amazing technologies in Alzheimer's that are evolving, everything from improved amyloid mapping in the brain so that you can image it better, to eye tracking mechanisms that provide early detection and potentially predictive outcomes. There's a whole range of gamification platforms that are being used for diagnosis in Alzheimer's and in other diseases. And we, just as an example, Pfizer are in fact partnering with some of these diagnostic companies because we believe that some of the failed therapies, right, this rash of failures recently in the clinical setting have something to do with being able to pick the patients well and to have some predictive platforms. So we're looking at biologic markers or biomarkers, but we're also looking at these other sophisticated diagnostics, and we partner, I think to the earlier question about are you developing apps, you know, we're not the app guys, we're the medicine guys. And so we're partnering, we're also not the diagnostic guys, we're the medicine guys, and so we're partnering with a lot of the diagnostic companies. Thank you for mentioning the White House Conference on Aging. 3 years ago I did a TED Med talk, and it was around meta collaboration as an area of focus. And I used a comment that my husband always says to me, because I'm always the one who says, oh, well, if you just educate people, they'll be enlightened and, you know, everything will be fine. And he says, look, people do not change when they see the light. They change when they feel the heat. Ah. And so from an Alzheimer's perspective, I think over the last several years in particular, there's been a lot of heat felt on the scientific community to accelerate their work, to the political community to advance policies, to the healthcare community to do its work, and for us as a community to begin to face up to it as one of the defining areas of our time. This is our equivalent to putting a man on the moon, I think, as a time. And I believe that there's enough heat to make that happen.
How does the potential cost to the economy, I don't know if you'll know this answer, but I'm going to ask it anyway, the cost of Alzheimer's on the global economy versus the cost of cancer over the years, or how does it compare?
So I don't know the exact numbers, but Alzheimer's is an increasing burden on the economic front globally. And I gave you the $1 trillion number for the US. Now amplify that as we're not going to be the oldest of all countries in the world. Japan will be out in front of us. China, in the not distant future, will have more people over the age of 65 than we have people who live in the United States. Huh. So, and with advancing age, they're going to face the same challenges. So the global cost of this is going to be tremendously weighty. It's hard to do the cost and the cost comparisons, because when you do the direct costs for Alzheimer's, that's one thing. And I don't know how many people in the room are caring for someone with even early stage Alzheimer's, let alone advanced Alzheimer's. I know I am. And the cost to the family, caregivers who are pulled out of the work environment, the cost to the family for managing this, especially in the home in the early days, and with advance, you know, the cost to the families beyond the actual cost for the care. So these are very hard to add up and to get our arms around, but all of the numbers that we have been able to take a look at are large, and they're large today and frighteningly large out in the not distant future. And you cannot determine the cost of stress. That, I mean, I don't know what your situation is with dealing with Alzheimer's, but you cannot measure the cost of stress on you and people close to you, right? Well, you can measure it to some extent, because caregivers are some of the most at-risk people for health issues ever. 50% greater cardiovascular disease, 30% greater diabetes. I mean, the list just goes on and on and on. So the actual health impact on caregivers is tremendous. And the emotional impact of this disease in a family is quite dramatic. When I was in medical school, the end of my first year of medical school, My mother died in the summer, I mentioned earlier, and as an only child, that left me with the care of my aging grandparents, the uncle that I mentioned that had lived with us, who had by then advanced to his late 60s with all the health issues, and not soon after that, I was, building a family, so I had 2 small children on board, and my grandmother began in early stages of dementia at that point, and I was responsible for the caregiving. And it was really interesting, balancing act to be in my residency and then to be a young physician with a young family trying to balance all of this. But more than that was the emotional cost of this for us collectively. And I always said, my grandmother was full of, kind of sass and sizzle and, spice. And when I was young, I just really wanted to be like her. Like, I just want to be exactly like her when I grow up. Well, I have to tell you now, my biggest fear is that I will be.
Yeah.
That I bore witness to the most moving and horrific decline in someone that I could imagine. And to even think that that could be me in 10 years' time or 20 years' time, and that my children and grandchildren would experience what I experienced is, enough to make me want to do all the things that are possible for us as a company, for me as an individual, and for us collectively as a community to get this under wraps.
Yeah. Yes, over here. Mm-hmm.
So you mentioned something earlier that kind of caught my eye. You talked about a medical team or having a medical team. In the spirit of preventative efforts, what are the members of that team? What are the major screenings that one should do throughout the course of their life to get a handle on some of the issues before they become bigger ones? And then how often should someone do that?
No, thank you for asking that question. The answer is, it is individualized, so you should sit down with your team and put a personal plan together. That team should help you with a nutritional plan, so I think nutritionists or someone with nutritional knowledge and information should help. You may want a physical therapist or a physiatrist. You mentioned a hip, and I think is your left one and my right one, so we're a match here.
Both of mine.
So, depending on who you are and where you are in, kind of your stage of health, you may include a whole range of individuals. Young women, for example, may have an OBGYN plus a pediatrician for their children who's a part of their family's team, a primary care physician. And again, I think nutrition plays such a significant part. Many people have other therapists. You mentioned stress earlier. There is so much that we can now do in terms of managing stress with biofeedback, with cognitive behavioral therapy, with other forms and fashions of intervention. So I consider healthcare teams, these broad teams that are put together of consultants that you can dip into, and don't forget to add as a part of that team kind of health information sources. So it doesn't always have to be people, right? Sometimes it can be a website that you vetted and trust. It can be apps that you use that inform you. So kind of this kind of whole range. And absolutely check. You mentioned, when you should do your screenings. Once you collect all that information about you, you'll know, when is right for you to have mammographies, when is right for you to have PSA screenings, what is right for you to have colonoscopies, when is right for you to go in and check because you have a high risk of melanomas in your family, et cetera. So that's why that's individualized. And the other one is vaccines. Many people forget about vaccinations once they're not kids anymore. And it is really an important opportunity to have your vaccine status rechecked as an adult. And you should work with your team to know what those vaccinations are as well. And it's not always you. I became a grandma in October, and one of the first things that my husband and I did when we found out that we were expecting was to talk to our physicians about what vaccinations we would need, not just to protect us, but to protect our grandson. So, you know, life circumstances shift and change, and, you know, you work with that healthcare team to make sure you know what's right for you and your family. And the broader, the better.
The broader, the better. Freda, we're out of time.
We're out of time.
Oh boy, thank you everyone. Thanks so much.
Thanks
this was
to you
great.
all.